and welcome to our November market commentary. This one is a little different than our typical market commentary. We're trying to do every other month. One month is a true market commentary, and then another month is more topic related. And we figured it would be good timing with open enrollment coming up to talk a little bit about the integration of your FEHB with Medicare. As always, we'll address the Q&As at the end, so feel free to put your questions in as we go along. And we will post this video to our YouTube so you can have the access to the slides there and revisit anything that we went over. My name is Evan, and I'm joined by Austin and Amanda. And the agenda for today is going over some important deadlines for both Medicare and FEHB. We'll talk a little bit about the integration of FEHB with Medicare and some details about open enrollment. So first, we'll start with the Medicare deadlines. So the initial Medicare open enrollment is the 3 months prior, the month of, and the 3 months after you turn 65. This is the typical time when most people enroll into Medicare. The special enrollment is if you're still working past 65. The special enrollment is the 8 months after you separate from service, and there's no penalty to enroll after 65 as long as you're covered by the employer plan. And important note here is just because you're covered by FEHB past 65, but you're not currently working, that is not full coverage. So it is important to note that the special enrollment is only available if you're still working. And if you enroll 8 months after you separate from service, no penalty to enroll in Medicare. And then the general enrollment for Medicare, if you miss one of these deadlines, basically the open enrollment for Medicare is from January 1st until March 31st of each year. The penalty for missing these windows is a 10% increase on your Medicare Part B premium for life on each 12 months you miss it. So if you enroll 2 years after you were supposed to, there will be a 20% increase on your Medicare premiums for the rest of your life. And these are what the premiums look like on your Medicare Part B. It is based on your modified adjusted gross income. So your wages, pensions, any withdrawals from your IRAs, capital gains, all that goes into your modified adjusted gross income. And it's important to note that your Medicare premiums for this year are looking at your tax returns from 2 years ago. So for 2025, the IRS is looking at your income from 2023 to determine what your Medicare Part B premiums are. And if we look at the chart here, there's pretty big differences, right? Where if you're married filing jointly, if you're below the 212,000 threshold, it's only 185 per person per month. But if we go up 3 brackets and your modified adjusted gross income is between 334,000 up to 400,000, 480 per month per person. So you can see that the premiums go up pretty significantly as you go up the brackets. One additional thing to note here is if you're retiring when you're 65 and you're going to enroll in Medicare, you might want to consider filling out the SSA 44 form. And that's saying, don't look at my 2023 tax return. That's why I was still working. My situation now is actually a lot different, and you can adjust your Medicare premiums by doing that.
And another thing to pitch in here, while we've got the premiums up and the income ranges, if you're a client of ours or you've been through a meeting, you've definitely heard us talk about this. But another thing just to think about when you're wondering, should I sign up for Part B, is your income when you retire is not necessarily your income throughout retirement. A lot of feds, especially, right? You're going to retire. You might have your pension only, but then eventually you're going to have Social Security kick in. Social Security. That's going to add to your income, so that's going to be included in your Part B premiums down the road. Then eventually you might have required distributions from your retirement accounts. Those required distributions are also income. So if you have a big traditional tax deferred retirement account, we see a lot of people actually who would imagine, they retire and then their first Medicare Part B premium, and they say, sure, no brainer, let's sign up for Medicare Part B. But then they get into their mid 70s and they've got this required distribution, and that required distribution actually pushes them up into higher Medicare premium brackets. And the unfortunate part about that is that's when they really need Medicare Part B, right? Because that's when your health kind of starts going the other direction, and you might need that care more. So when you're thinking about the premiums and what this is going to cost you, just encourage you to not only think about where your income is right now, but where it will be throughout retirement.
Matt, that's a great point. And then it'd be,
Um,
I was going to
sorry,
say, in that situation, you might enroll and be enrolled in Medicare for a couple of years and then drop it down the road once those RMDs kick in and you had that coverage all along the way for no reason.
yeah. And Evan, we had a question from Diane, and we're not going to address all the questions as they come in. We'll leave most of them until the end. But this one was on. If you could actually go back to the last slide real quick, I think this is a good point. So Diane asked, if you sign up for Medicare after your initial window, but during the general, and it's less than 12 months since you, okay, so this is like, so you've turned 65, right? You've turned 65, um and you didn't sign up within this 65 window. Let's say you turned 65 in February of this year, right? And you didn't sign up during this window, so you missed that initial window. But then the general comes around, and in January, you're still 65. It's not 12 months later, right? You're still 65. Um, you sign up there. Are you penalized for that? And the answer is no. You can actually do
Uh,
that as long as it has not been 12 full months. The
Um,
10% penalty doesn't kick in.
Austin, I would say yes, because coverage doesn't kick in until July if you're in the general enrollment period. So you're more than a year after. So
Yep, got it.
just wanted to
Yep,
give that caveat because
sure.
the Mhm.
So the answer then, Amanda, you're confirming then that it's you would not be penalized, right?
No, you would be.
Mm.
Oh, you okay?
We
So
just ran into this with a client actually.
did you?
Since
Okay.
Yeah, since with your since if in the example you gave, Austin,
Uh-huh.
since in the general enrollment, your coverage doesn't kick in until July. So you're more than a year after
Got
your
it. So
birthday.
even though you've enrolled, your coverage doesn't kick in until July, so you do wind up getting penalized. Okay, thank you, Amanda. Sorry
Correct.
for
Yeah.
sorry for the misdirection there.
Yeah. So it sounds like you might not get that 10%, but it's better to do it within the window. Um, let's see. So just to recap here, a couple of big milestones. Once you turn 63, that's a good time to start thinking about Medicare because that's the first year that your Medicare premiums would be based on. So that's a good time to start seriously thinking about these things, if not earlier. Another big consideration with Medicare is you are no longer allowed to contribute to a HSA. So making sure that you stop those contributions 6 months prior to enrolling in Medicare. And as we discussed, the 3 months before you turn 65 is when the initial enrollment begins if you're no longer working. Um, and again, no longer able to contribute to the HSA once you enroll in Medicare. So that was a little bit about some deadlines. Now I'll hand it off to Austin to talk a little bit about the integration of Medicare and FEHB.
Sure. And I've seen a couple questions coming in about we have this FEHB. That's pretty good. Does it make sense to enroll in Medicare Part B still? And that's exactly what I'm about to talk through here. So when we look at Medicare Part B and what's included in that, it's really very similar to what's included in your FEHB plan, right? It's doctors, visits, inpatient, outpatient, it's surgery, lab tests, preventative services. Medicare Part A covers major medical. You wind up in the emergency room, something like that, right? That's what Medicare Part A covers. But Part B is really, it's very similar to your normal doctor's visits that are kind of covered under FEHB. So you're right. There is some overlap there. And also, when we're looking at FEHB in retirement, another question that people ask sometimes is, okay, great. I know what FEHB looks like when I'm working, but is FEHB any different in retirement? And the answer is no. FEHB is really the same program when you're retired as it is when you're working. You're paying the same premiums. The government continues to subsidize those premiums, which is an incredible benefit. You have the same plans available to you. You have the same providers, all of that. You can switch your plan during open season, just like you always have been able to do. So you're not stuck with the same FEHB that you choose when you retire. You're able to switch at any time. So there is a good question there. Why would I add Medicare Part B when I have this FEHB coverage? And the answer is that they are made to work together. Okay, so what that looks like, before talking about the dollars and cents of how it works, when you have both, when you're still working, so say you're working and you're in the special enrollment period because you decided not to enroll in Medicare Part B yet because you're still working, and that extends when you can enroll. So maybe you're 65, 66 years old, you're still under FEHB, but maybe you've taken Medicare Part A because that's free, right? And there's no reason not to take Part A even if you're still working. So let's say you have Part A and you have FEHB. Then what happens is while you're still working, FEHB is your primary insurer and Medicare is secondary. Medicare, they would come up and pay extra premiums that were needed if you were to wind up in the hospital and you had Part A and they had better coverage, right? They'd pay that. Then you retire and that flips. When you retire, Medicare becomes primary and your FEHB becomes the secondary coverage. Same is the case for your spouse. So if let's say you retire before your spouse, okay, but they have their own insurance, okay, but you sign them up for Medicare Part B. If your spouse is working, and this is kind of the caveat, it depends on the size of the company actually. So if you're working at a company with less than 20 employees, Medicare actually is your primary, and your insurance is the secondary. For most companies, though, large companies like the government, it's going to be the way we covered in the first two, which is while you're working, your FEHB is primary, Medicare secondary, and then that flips once you retire. So we've talked a lot about how these work, but what does the cost look like exactly? How do these coordinate? What are the pros and cons of having these together? So when you only have FEHB, again, I'm not going to really go through all this list because we just talked about it, right? It's pretty much the same as when you were working. You're paying the same premiums. The benefit is that you don't have this extra cost of Medicare Part B. You have the same doctors available to you, all this. Now, on the right-hand side, we see when we combine FEHB with Medicare Part B, the primary benefit of this is this integration of coverage. It's when you do that, Medicare and FEHB are designed to work together so that you effectively have no out-of-pocket costs once you have both of those coverages. On most of the plans, your copays, if you would have had copays before with FEHB, those are completely eliminated when you add Medicare Part B. It actually they pay copays, so it's designed so that you almost have no out-of-pocket costs. Okay, now the con, of course, is that you're paying a higher amount, right? this works really well, having this combination of coverage if you have a lot of primary care visits or specialists, you're going to physical therapy, you're going to these outpatients where, if you had just a normal plan, you're probably getting a $40-50 copay every time you go to the office, right? Where when you have that combined coverage, you don't have any copays, and that can oftentimes pay for itself. Then another benefit, and we'll talk about this on the next slide, is that a lot of the FEHB plans, when you add in Medicare, they will actually give you a kickback. When you think about it from the FEHB plan's perspective, it's really good for them when you add Medicare, because Medicare becomes the primary insurer when you retire, right? So the FEHB plan, their expenses for you go way down because Medicare is paying most of it. They would really like to keep you in their system, so they develop these special plans that coordinate with Medicare, and a lot of them will actually kind of pay you back for having Medicare Part B. So let's go to the next slide. And there's two real kind of categories of the FEHB plans fall into two categories when it comes to their coordination with Medicare Part B. There's true FEHB Medicare Advantage plans. These are made to coordinate with Medicare, and these are going to be the cheapest option. Okay, so these are kind of special plans. They will dramatically lower the amount of coverage under the FEHB side of things. So one of the cons of that is, you have to be kind of careful about your provider and being in network and things like that. If you travel overseas, that may not be covered very well under these Medicare Advantage plans, but they still offer that comprehensive zero copay type of coverage. They're going to be the cheapest option, and a lot of them are still going to offer a kickback. So, like a couple common ones are Aetna has an Aetna Advantage plan, and GEHA has an Advantage plan. And if I'm correct, I think both of those plans offer $100 a month kickbacks to help you pay for your Medicare Part B premiums. So not only is the cost of the FEHB plan lower, but they're also giving you $100 a month or so to pay for those Medicare Part B premiums, which, if you're okay with the level of coverage, can be a really good deal. Then there's the FEHB plans that complement Medicare Part B. These are not specifically designed to work with Medicare Part B, but they still have this integration in the complement. The most common version of this, we see probably over 80% of the clients that we talk to are on Blue Cross Blue Shield. Blue Cross Blue Shield has their basic coverage, which complements Medicare Part B. It's not designed for it. You can have basic without being on Medicare, but the Blue Cross Basic will give you $800 a year towards your Medicare Part B premiums. Or they give it to you as a credit. You can use it for your Medicare Part B premiums. That's the idea. And a lot of the same things are true here, where zero copays for most things, outpatient, lab tests, things like that, zero copays. And the benefit of being in something like this is that while it may be more expensive, the reason a lot of people are on this Blue Cross plan is just because the provider options are so extensive, right? You can go overseas, it'll work overseas. You can travel most places in the US, it'll work there. So it's worth a look. A lot of people that I talk to, they are used to Blue Cross, so they just stick with this plan because that's what they're used to. And they say, hey, great, at least I get a benefit for being on Medicare Part B. But more people could probably benefit from actually exploring some of these Advantage plans and seeing if that works within the providers that you're comfortable with. So this is something to spend some time with. Think about what this looks like in your situation. And Amanda's going to talk here a little bit about how to actually explore some of those different options on the website. So Amanda, we're approaching open enrollment right now.
Yep.
what does this look like and how should people be considering this?
Yeah, no, thanks, Austin, there. And for everyone, open enrollment does begin on Monday here, so November 10th, and runs through December 8th. So you have a full 4 weeks there. And open season, requires you to go online, register, enroll at login.gov. Also, with your login.gov account, you can also, securely connect to multiple government accounts online, like Social Security Online Services. You can go on TSA PreCheck, Global Entry, other, federal agency portals like Medicare and IRS. Instead of, remembering separate logins for each agency as well there. So, also get that all through that login.gov credential. If you do not want to change your present FEHB insurance coverage, there's nothing you need to do at this point. Your coverage, will continue automatically unless your plan no longer, participates in the FEHB program. Then you'll want to log in and take a look at, other plans that are available. Go ahead. But it is, always a good idea to, review your FEHB plan each year, during this open enrollment season, since, premiums, coverage changes, your personal healthcare needs do change. This makes sure, ensures that you keep the most cost-effective, suitable plan. You can go on to the OPM website and access the tool. It's called the FEHB Plan Comparison Tool. You can just search for it. You can search for the plan specific to your location and, your certain status, and be able to compare, all the available plans, available to your area. And this is just an example. Don't feel like you need to strain your eyes to see this, but you are able to search, which plans specifically coordinate with Medicare, have the MRA benefits, Austin and Evan were talking about, and what costs would actually apply in the coordination if you had Medicare Parts A and B there. So that's always a good resource you can go and look at. And also, if you haven't signed up for Medicare before, one of the easiest and fastest ways is through the ssa.gov website, and applying through your Social Security account. But you can also call Social Security, visit the local Social Security office. Also good resources there too. But as we talk about, open and general enrollment, one of our most, asked questions from current and potential clients we meet with that have FEHB is, should I be enrolling in Medicare Part B when I already have coverage? And at the end of the day, deciding whether to enroll in Medicare Part B is pretty personal. There is not necessarily, a one-size-fits-all answer. But some of the questions, we ask with clients to help them decide is, first, your health status. How often are you visiting doctors or specialists? Do you have or expect ongoing, care for a chronic condition? And, that might be a big unknown today. But, if you think you may, Part B might save you a lot in out-of-pocket costs. Second, your budget, can you comfortably add, $185, or as Evan shown, even more, per month without cutting back? Or could you afford to, hit the out-of-pocket maximums of your FEHB plans every year? If not, maybe it's worth insuring, that monthly cost. Third, do you want the flexibility to kind of, see providers nationwide? Because Medicare is domestically universal, or is staying local within your FEHB network enough? But if you're also like some of our clients that travel more than they're here in the States, Medicare does not cover you overseas. So that's a big consideration that we have. But finally, your risk tolerance. Do you prefer predictability? Paying, maybe some higher combined premiums between, Part B and FEHB, but lower costs when you actually use the care. But are you more comfortable with cost variation, exchange, having those lower premiums on a monthly basis? So some of the things that we kind of go over with a lot of our clients. But the good news is, federal retirees are in one of the best positions in the country when it comes to healthcare. Whether you stick with FEHB or you put on top of it Medicare Part B, you still have strong protection either way.
Mm. Yep. And one thing to add there is Austin made a great point earlier is another big takeaway and consideration is what are my Medicare premiums gonna be once I have my pension, Social Security, and RMDs kicking in? What are my premiums gonna be at that point?
Yep. Yep. So we'll get to Q&A. We've seen a lot of these questions coming in here. Good questions. We'll get to these. We knew there were going to be a lot of them on this one. Before we jump into that, I just want to talk real quick for those of you who, I see a lot of you that are on this call are clients of ours. For those of you who are not and are interested in chatting with us, we're not just a Medicare team here. We're a full financial planning team. We specialize in working with federal employees, helping them plan for retirement in all kinds of different ways. So we offer a retirement readiness call. This is free. This call is with Austin, with me, with Evan, with Amanda, with one of our advisors or coaches here. And we get an hour to just talk through what the questions you have, about Roth, traditional TSP, what your investment objectives should be, when you should be taking Social Security, any of these questions here and more. What I would say about this call is we call it retirement readiness for a reason. We kind of offer one of these free to everyone during their career. And we just think you get the most value out of it if you are in that retirement preparation or recently retired phase. So if you're going to sign up for this call, we always recommend, hey, you're within 5 years or you're recently retired. We really think to get the most value out of that call. So feel free to scan the QR code there, go to retfed.com/register, and we'd be happy to have that call with you.